You can turn subtitles on by clicking this symbol in the bottom right corner. By clicking the cog next to this, you can also adjust the playback speed to make the speech whatever speed you feel comfortable listening to. In the description below, you can find web links to all the websites, videos and resources that are mentioned during this video.
In section 3, we found out the factors that can increase the risk of type 2 diabetes. In this section, we'll be talking about the potential long-term health effects of type 2 diabetes if blood glucose levels are not kept within target. We'll also be talking about all the tests a person with type 2 diabetes is entitled to receive as part of their diabetes annual review or their yearly diabetes checkup. We will also talk about the positive things a person can do to help reduce the risks of developing long-term health effects. Too much glucose increases the risk of a heart attack or a stroke, brain damage. Keeping blood glucose levels within a healthy range can help reduce the risk. Eyes. You should have your eyes checked by NHS retinal screening every year. Too much glucose in the blood can cause severe eye problems, which can lead to retinopathy and possible blindness. A patient with type 2 diabetes will be invited to have a retinal screening test every year to check the tiny blood vessels in the retina at the back of the eye. This would be done by taking a photo of your eye with a retinal screening camera. Make sure that you attend your free yearly diabetes retinal screening test. Keeping your blood glucose levels within a healthy range and attending retinal screening can help reduce the risk of eye problems. Nerves, leg and foot circulation. See your nurse every year for a foot check. Too much glucose in the blood can damage your circulation and nerves and affect the flow of blood, which can lead to ulcers, infection and, in the long term, potentially amputation. Keeping your blood glucose levels within a healthy range and attending your yearly diabetes annual review where your feet will be checked can help reduce the risk of foot problems. Kidneys. See your nurse every year for a blood test and a urine test to check the health of your kidneys. Too much glucose in the blood can damage your kidneys. A person with type 2 diabetes will have a yearly blood test and a urine test to test the health of their kidneys. This test will be done every year as part of your diabetes annual review. Keeping your blood glucose levels within a healthy range can help reduce the risk of developing kidney problems. Erectile dysfunction. Too much glucose can affect your nerves and circulation, which can affect the ability to achieve an erection. When you see your nurse every year, they should ask, do you suffer from erectile dysfunction? Keeping your blood glucose levels within a healthy range can help reduce the risk of erectile dysfunction. There are lots of other reasons why a person may suffer from erectile dysfunction. Anxiety, depression, and some medications may have an impact and reduce the ability to achieve an erection. If a person has an operation or surgery in this area of the body, it could also have an impact. If you have not been asked this question and you do suffer from erectile dysfunction, then please discuss this with your GP, practice nurse, or healthcare professional. The HbA1c blood test measures your overall blood glucose control over the past 3 months. Have your HbA1c blood test twice a year. A result of 48 millimoles per mole or above means a person has diabetes. Once you have been diagnosed with diabetes, keeping your average blood glucose level, your HbA1c, between 48 and 53 millimoles per mole helps reduce your risk of developing diabetes-related health complications. This level may be adjusted on an individual basis depending on any other health conditions that you may have. Cholesterol. See your nurse every year for a cholesterol blood test. Cholesterol should be checked every year. Your practice nurse or other healthcare professional will take a blood sample as part of your diabetes annual review. Everyone produces cholesterol in their bodies. Some cholesterol is good and some cholesterol is bad. Ideally, total cholesterol should be no higher than 4 millimoles per litre. The bad cholesterol is called low-density lipoprotein, or LDL. LDL can stick to the side of the blood vessel, causing the vessel to narrow and increasing the risk of heart attack and stroke. Ideally, an LDL result should be less than 2 millimoles per litre. The good or healthy cholesterol is called high-density lipoprotein, or HDL. Ideally, we want to have a higher number for our HDL. Men would ideally have an HDL result of 1 millimoles per litre or above. Women would ideally have an HDL result of 1.3 millimoles per litre or above. Cholesterol can be improved by eating less saturated fat in the diet. Swapping to unsaturated fats in the diet and increasing physical activity can help increase your HDL cholesterol. If we have a raised cholesterol level, this can lead to problems such as heart attack or stroke. You may be offered a cholesterol-lowering medication by your GP or practice nurse or healthcare professional to help reduce your cholesterol level. High glucose, high cholesterol, and high blood pressure altogether increases the risk of a heart attack and stroke further. Blood pressure. See your nurse twice a year to have your blood pressure taken. A healthy blood pressure for someone with type 2 diabetes is 140/90 or less. This level may be adjusted on an individual basis depending on any other health conditions that you may have. Being overweight can have a negative impact on blood pressure. Eating healthily, reducing salt intake, and being more active can help improve your blood pressure. If your blood pressure is raised, you may be offered medication by your GP, practice nurse, or healthcare professional to help reduce this. Smoking can make your cholesterol worse, narrow your blood vessels, and increase your risk of diabetes-related health conditions. See your practice nurse or GP if you would like help to stop smoking. How do we reduce these risks of developing complications? Reaching blood glucose targets, good food choices, physical activity, taking medication if needed. Keeping your blood glucose levels within a healthy range can help reduce these risks. Healthier food choices. By reducing carbohydrate portion size, by reducing calories if we need to lose weight, by increasing our vegetable intake, by choosing fruit over other sugary foods, and generally having smaller portions of food on our plates if we need to lose weight. Being as physically active as possible, reducing our time sitting down, and moving our bodies more if we are able can all help reduce blood glucose, blood pressure, cholesterol, and weight, and can have a positive impact on mental health. Make sure you attend your yearly diabetes review. Taking medication as directed by your doctor or nurse if needed can also help to reduce the risk of developing complications. This concludes Section 4, the potential long-term health effects of type 2 diabetes if blood glucose levels are not kept within target. In the next section, we will be talking about healthy food choices.